Good afternoon, everyone. My name is Mos Beauty. Our topic for today is female reproductive system. Female reproductive system. Female reproductive system is also called female genitalia. Female reproductive system or female genitalia. And the female genitalia is made up of two sides: the external genitalia and the internal genitalia. External means outside, internal means inside. The external genitalia is also called the vulva. The vulva. The vulva is that part that you clean with your cotton wool mixed with antiseptic lotion, either Purity. When you want to do VE, that place you use cotton wool mixed with Purity to clean 4 times. You say I clean the labia majora, clean the labia minora 4 times before putting my hand for VE. That part you are cleaning with your antiseptic lotion mixed in cotton wool is your vulva or external genitalia. Then the internal genitalia, starting from the vagina. The vagina, where you put your hand to check the cervix to know how many centimeters. Vagina 1, uterus 1, uterine tube or fallopian tube or oviduct 2 in number. Then the ovaries 2 in number. The vagina is 1, uterus is 1, the uterine tube or fallopian tube, that one that is like this, is 1 on this side, 1 on this side. Ovaries, the same thing, 1 on the left, 1 on the right. That is the internal and the external genitalia. The diagram of the vulva, that's the external genitalia. This first part here is the mons pubis, where hair used to grow, where you shave. That on top part you shave is the mons pubis for a female. Then you have folds, 2 large folds. This is one, this is the second one, and 2 small folds. This is one, this is the second one. These big large folds are called labia majora. Labia majora. There's a flap here, that big flap. By this side of the flap, this side of the folds, hair used to grow there. So when you are shaving here, you still shave these sides too. These big folds here is the labia majora. Then these smaller folds, it's used to cover that red part. The smaller folds, called labia minora, is the one that covers the red part. When you want to do VE, you open the small folds, which is the labia minora. You open them, then you see the red part, which is the vestibule. The vestibule. The vestibule has a small hole on top and a big hole below. This small hole on top is called urethral orifice. Urethral orifice. This urethral orifice, this is where you put your catheter. When you want to catheterize a patient for any operation, this is where you put the catheter. And in the labor ward, when you want to empty the urine, because before you do any VE for any patient, you must empty her bladder. You empty her bladder. This is where you put your catheter to empty the bladder, or you put your catheter for any operation. This orifice is coming from the bladder. That's why they say urethral orifice. The urethra is the one that collects urine from the bladder outside the body. So that's why it's called urethral orifice. Then this hole below the vestibule is called the vaginal orifice, which is the hole that opens into the vagina. Vaginal orifice. By the side of the vagina, you see small dots here. These dots are called vestibular glands. Vestibular glands. They are on top of the vestibule. The urethral orifice is on the vestibule above, below the vaginal orifice, and by the side of the vaginal orifice is the vestibular gland. gland. They also call it Bartholin's gland, vestibular gland or Bartholin's gland. This gland secretes mucus that keep the vagina moist. It also secretes mucus that helps to lubricate this vagina during intercourse, during sex. It helps to lubricate this vagina, and it also helps to keep the vagina moist. When this gland is blocked, that's when they'll say this person is having Bartholin's cysts. This is the place that gets blocked, that they say this person is having Bartholin's cysts. It's actually the vestibular gland that is affected. This up part here, in between these two flaps or two folds of the majora, is the prepuce. The prepuce is like a foreskin covering the clitoris. That foreskin that is covering the clitoris is very small, it's this side. Some people's own are big, depending on the nature of the woman. Some are small, some are big. This is the clitoris. The clitoris is on top, the minora. Then this fold is like a skin housing the clitoris. It's called the prepuce. This prepuce is the same prepuce that male have when they give birth to them. That is what they cut off during circumcision. This prepuce, in male, they cut it off during circumcision. That's the foreskin covering the penis. This is also a foreskin covering this clitoris. This labia majora, it joins the symphysis pubis, which is the bone underneath this mons pubis. It joins the symphysis pubis anteriorly, and posteriorly it joins with the perineum. This is the perineum. This space between your vagina and your anus is called perineum. During delivery, when the head is crowned, it is this part that you will use, whatever you are holding, mostly pad. You use your pad to secure this area when the head has crowned and the woman is pushing out the baby. You use your pad to secure this area, pressing it downward while the baby is pushing outer part of the baby is coming out. You are using your hands to press the perineum to prevent tear. Because most times, if this place is torn, it can tear to the anus, and you are trying to prevent that. So it is this perineum or perineal area that you put your pad to press while the baby head is coming out. So the vulva made up of mons pubis, where there is hair, big, large folds to labia majora. The small folds, labia minora. The red part in between the small folds, the vestibule. The small hole above the vestibule is the urethral orifice. The bigger hole below is the vaginal orifice. Then there is a gland on each side of the vagina, left and right. Vestibular gland or Bartholin's gland. If it's vestibular gland, then the part between the vagina and the anus is the perineum. Between the vagina and the anus is the perineum. Then you have the anus. So this is the anatomy of the vulva or the external genitalia. Talk about blood supply. The blood supply to the vulva is node. So that is all concerning the vulva. If you have any question, please put it down on the comment section and I will give you answer to it. Thank you.